friends around the world, welcome back to another video. Today we are going to be talking about masks. So a lot of you, I'm sure, have been getting lots of information about whether you should wear it or shouldn't wear it. Should you wear a store-bought one? Should you wear a homemade one? And we're going to be covering that today. Today's information is coming from a couple of articles that were published in The Conversation and some guidance from the Centers for Disease Control and the World Health Organization. All right, so the main reason why people should wear a mask is if they have symptoms and they want to protect other people from being exposed to those symptoms. So this is particularly important for COVID-19 because people have a tendency to be infectious for 1 to 3 days before they show any symptoms. So you can possibly spread the disease to other people without knowing it. So, and this is also really important because people are particularly bad at covering their mouths when they're sneezing or coughing. So even, coughing like that into your sleeve is not fully effective at preventing those droplets that contain the virus to spread out into the air. So World Health Organization and the CDC recommend that you should be wearing a mask if you're sick. But the CDC has recently released guidance saying that you should be wearing a mask anytime you're around other people. So even if you're not showing symptoms. The World Health Organization hasn't released similar guidance. They're just saying that you should only be wearing a mask if you're sick or are in contact with someone who is sick. So why is there this difference? Why is there different information going around? So there's really mixed evidence as to whether or not masks work. There's a big difference between the type of mask that a doctor might wear versus the type of mask that you can buy over the counter or the type that you can make at home. So the kind of masks that a doctor or a nurse might wear are an N95 masks. So these have filters in them that are small enough to block any very small particles that might try to enter. A store-bought mask or a homemade mask, like a cloth mask, has much larger spaces between the fibers, meaning that more viral particles can easily pass through. They're also don't have, they might cover your nose and your mouth, but they don't have a face shield, and your eyes are another membrane that can enable the virus to pass through. That's why doctors wear full protective equipment, including gloves, masks, and eye covers. So even if you're wearing a mask, that doesn't necessarily protect your eyes. People also have a tendency to wear masks incorrectly, so they don't always wear them so that they fully cover their mouth and their nose. They also don't replace them when they become damp, for example, for breathing into like a paper one for a long period of time, or when they touch their face or they remove it, they might touch part of the mask that's contaminated and then not wash their hands, and then that contamination spreads to them. They can also give people a false sense of security. They might do riskier behavior, or they might forget to do all the other things that they should be doing to keep themselves safe, like washing hands and doing social distancing. So just because you're wearing a mask doesn't mean you can all of a sudden be in close proximity to other people. However, there is some evidence to show that masks can be effective at preventing the spread of the virus. So in a laboratory study, it was shown that masks reduce the amount of spread of a virus between people by about 10 to 20%. It's not huge, but it definitely was effective at lowering the spread of virus. If you are required by the government that you're in to wear a mask when you're out in public, like the US has done by the Centers for Disease Control, then yeah, definitely wear any store-bought masks or cloth masks whenever you are in a crowded space or out around other people. You don't necessarily, and it's not required by the CDC, that you wear a mask when you're, outdoors, not around other people, but in any indoor setting, you should wear one. For other people in other countries that you don't necessarily have this type of requirement, there's some things to consider about when you should wear a mask. So it might be best to wear a mask if you have any type of respiratory symptoms, so coughing or sneezing, or, again, if you're going into any close indoor spaces like grocery shopping. Another possibility is the 2x2 rule. So if you are outdoors, but you're within 2 meters of someone for more than 2 minutes, then that's another good reason to wear a mask. It's also really important to remember that you shouldn't be keeping N95 masks if you have them for yourself. Those are really only needed in clinical encounters where healthcare professionals are within close proximity to people who are very sick and they need that optimal level of protection. So consider donating those if you have them to your local health service. And remember, masks really only work properly if you wear them properly. And the World Health Organization has some great guidance about how to properly wear a mask, which I will share with you here. Covered some of the essentials about wearing a mask. If you are making masks from scratch at home, that's great. Feel free to continue to do that. Just be wary that that's not a perfect form of protection, that you need to still be mindful of not touching your face and washing hands, just as regularly, and practicing social distancing as many of you are required to do. That's it for now. Again, if you have any other questions or you'd like more information about a certain topic, please feel free to comment below. Otherwise, stay safe, stay sane, and I'll see you on the flip side.